29th, and we see what decisions the governor decides to make. We'll decide whether or not we need to extend our order or not. So we'll provide more information as we get closer towards the end of April. There are a few new things happening on the federal level that are going to impact us here locally that I wanted to talk about. First, North Carolina has been approved to operate a pandemic EBT program, which is for those who currently are eligible for food and nutrition services and for others who may be eligible for food and nutrition services. And it provides reimbursement to offset the cost of meals that would have been available at schools but are not available currently because schools are closed. So for those folks who are eligible or are currently eligible for EBT or currently get food and nutrition services, this will be helpful for them. The other thing that was approved today for the state of North Carolina is that those that do have food and nutrition services and have an EBT card will be able to buy groceries online at Amazon and Walmart. This is a tremendous opportunity for our folks who don't have access to food readily, but have that benefit and will be able to access that online. So we're very excited about that. And the third thing is that Medicaid recipients in the state of North Carolina will now be able to take advantage of telehealth services. So this will allow Medicaid recipients to be able to access virtual doctor's visits that will give them information about how to stay healthy during the COVID-19 crisis. And finally, on Wednesday, we'll be having another Board of County Commissioner meeting. We will be providing another update on COVID-19 here in Mecklenburg County. We'll also provide an overview and a briefing to our board about how we are responding to homeless residents in our county, as well as a legislative update to provide information about how and when federal resources will be coming to Mecklenburg County. So stay tuned for that. And now I'm going to turn it over to Gibbie Harris for a public health update.
Good afternoon. I have a few updates for you today. In terms of numbers, we now have 1,213 total laboratory confirmed cases in Mecklenburg County. We've had 31 deaths to date. We've provided through Atrium Novant 19,400 tests total, and that's from March 11th through the 19th of April. And over the past week, with the new sites that were opened by both Atrium and Novant, there were 289 tests completed. What we're seeing with our data is we have an additional infant under the age of 1 that has been infected. All of the infants have done well to date. We've seen a slight increase in the number of Hispanics who have tested positive, with a slight decrease in the number of African Americans. A slight decrease in hospitalization, and our mortality rate is 2.4%. We will be releasing that data a little bit later this afternoon. I wanted to talk just briefly about testing. There are lots of questions about that, especially in terms of when we might be able to reopen our communities. What we see in Mecklenburg County at this point is we still have fairly significant limitations on the testing that we can do. We still have challenges from time to time accessing the equipment and the supplies that we need to provide testing, including PPE. So we are continuing to prioritize those who we test. We are testing individuals who have symptoms, who are most at risk, and we're also making testing available to our first responders and our healthcare providers who've been exposed. That will continue until we're better able to access the supplies, including the PPE that we need to test more broadly. As we announced last week, we do have some outbreaks in long-term care facilities in this community. We currently have 8 long-term care facilities in outbreak status. That means that they have at least 2 confirmed cases in their facility. We're continuing to provide daily guidance and updates with those sites. We're working with them to make sure that they have the appropriate PPE that they need to protect their staff, as well as to protect the clients that they're serving. And we look for ways to isolate those individuals who have tested positive. I also want to recognize the sacrifice of the staff that work in those facilities. We've talked a lot about those who work in hospitals and in our first responders in the field. The individuals who are taking care of the elderly in these facilities fit in that category as well. They're going to work every day, potentially exposing themselves and then going home to their families. So I want to recognize their sacrifice and the work that they're doing. In terms of messaging for high-risk groups, as we've talked about over the past couple of weeks, we do have a larger percentage of positive tests among our African Americans, and we're seeing more African Americans over the age of 60 testing positive. I want to reiterate that there is no evidence due to genetic differences in how this virus spreads, regardless of the race. There are higher rates and earlier onsets of underlying chronic health conditions among our African Americans. We've talked about that before. And we also see many of our African Americans working in essential jobs. All of these things put them at more risk for COVID. So we're continuing to work with our community and with our providers to make sure they have access to testing as well as access to care. In response to that, we've released a toolkit last week with messaging that can be used by anyone in our community. In that toolkit, we have flyers that can be printed or shared digitally. We have infographics, digital images, and other messages for social media, email, blogs, or websites. And we have accurate talking points on COVID-19 topics. That information is on our website, but in addition to that, we had a webinar today for people to hear information and specifics about those documents and to be able to ask some questions about that. That information will also be posted on our website so that people have access. Lastly, I want to mention that we are also putting out some radio and print ads this week, and you'll see those as they come out. I want to now introduce Dr. Raynard Washington, who's going to talk to you a little bit more about the projections and address some of the questions that we've been getting about those.
Great, thank you, Gibbie, and thank you all. Just first want to start with a couple of expectations as it relates to projections. The first one of those is that we have reported and will continue to provide on some basis our current projections for where we think our hospital capacity will go here in Mecklenburg County. We have been working very closely with our partners at the healthcare systems to provide data for us on a daily basis for how many patients are hospitalized, their current capacity for beds, ventilators, as well as ICU beds. I also worked with them to provide for us information about how many of their current patients that are hospitalized have COVID-19. All that information allows us to be able to look routinely and every day at the models and projections for when they think that we might actually have a surge that might potentially reach the capacity, that might reach our capacity for healthcare services here locally. So just a few things about models in general. I'm an epidemiologist by training, so I tend to look at these things very, very closely. Models are estimates, and they essentially allow us to be able to understand better what might happen in the future based on what we know currently, as well as what's happened in other areas who've had this similar experience. As a result of that, it's just like weather predictions. So sometimes they're right, sometimes they're wrong. And we take that with, when we use these to inform our decision making, we understand that as an underlying assumption. They do help us to be able to make better decisions. However, they don't, and they inform our decisions, but they're not exactly the only source of information that we have at our disposal to help us understand how we should be responding to this pandemic. I'll speak a little bit about the peak in the models because I think you all have seen them, that they have been changing over time, and we expect that they will continue to change as we have been implementing a number of strategies to reduce the number of cases, the number of infections, the number of hospitalizations. We are successfully, effectively flattening the curve in our community. As a result of that, we really are, we expect, as long as we're implementing measures to avoid additional cases and surges, that the peak dates will continue to be pushed out further. And in fact, they'll be flatter. We'll have potentially fewer cases that will ever be hospitalized, but it doesn't necessarily mean that the total number of infections in our community are going to be necessarily less. They may be the same, but hopefully we won't all get infected at the same time and then basically overwhelm our healthcare system. So the peak will continue to move out, and we will continue to provide that information for you all. But just want everyone to understand that this certainly informs our decision-making around implementing measures and suspending measures, but it's not the only bit of information. We recently released some information about sort of what information and assumptions are going into the models. Those are available on the mecnc.gov webpage. We invite you all to take a look at some of those assumptions. Those were determined in partnership with the hospitals and their data science teams, and we're continuing to look at some of those assumptions and inputs and change them as things change in the county. And I will also just add that there are a number of models out there. We have been largely relying on the University of Pennsylvania's CHIME model. There are other models that obviously have more conservative estimates for what we think might happen with our demand in terms of our healthcare system. Many of those models are not available to the county at the county level. They're largely at the state and federal level. We are monitoring the situation very closely and continuing to produce estimates on a routine basis, like I said. It's not clear how well those state-level models will track with our local situation. For example, the case rate in Mecklenburg County is twice that of the state, and so what's happening here locally might be a little bit different than what we might expect for the entire state, both driven by population density as well as the number of people we have overall. So I'll end my comments there and look forward to any questions.
Thank you, Dr. Washington. At this time, I'll ask Deputy Chief Estes to come up and give us an update on enforcement.
Thank you. Good afternoon. Our enforcement efforts are largely where they were, hinging greatly on our enforcement through education and answering a lot of calls and about what's essential, what's non-essential. We've seen some gray areas that we've been able to help out. We've also made contact with the religious institutions in the area who have also had questions we've been able to sort out. So in large part, about 8 arrests, about 15 or so citations, and we continue along that route. We continue to urge people, if you're not out for an essential reason, then stay at home in adherence to the proclamation and the governor's orders. Thank you.
Thank you, Deputy Chief Estes. Now we can open it up for questions. No questions? Okay, thanks. No, I'm just kidding.
Hey, Bruno from Channel 9. This question is for Ms. Harris. How likely is it that the stay-at-home order will be lifted if these significant limitations with testing and challenges with obtaining PPE aren't resolved by the 29th?
Here's the answer to that question. Every governor, even at the federal level, the discussion has been, if we're going to start releasing some of the pressure on some of the restrictions that we've seen across the country, we've got to have better testing available to us and better contact tracing. At this point in time, in this county, we do not have that. We are still looking, as I mentioned earlier, at deficits in testing capacity and PPE. We'll continue to monitor that. We hope that some of that, there will be some relief from that. But at this point in time, it's hard to say that we would completely open back up on the 29th of April without that happening.
Gibbie, it's Hunter here with WCNC Charlotte. Following up to that question, do you recommend that people in our community keep a journal of who they've come in contact with to help with that contact tracing?
I'm not sure that a journal is necessary. That's an individual choice of each individual. My hope is that with social distancing, most folks are not going to have trouble remembering who they've been in contact with, because I'm hoping that's a short list.
Gibbie, it's Allison Kuznich from the Charlotte Observer. Can you talk about nursing home information? So you started to release the nursing homes that are affected. Will you be releasing the number of confirmed cases within those nursing homes?
We're not releasing the number of confirmed cases. At this point in time, that information is not useful to the public. And is not necessary, I don't believe. And we are also, you have to remember that these nursing homes are people's homes. And we're continuing to do what we can to protect people's individual information. So at this point, we do know that there are at least 2 confirmed cases in each of the nursing homes that we've named, and that's probably the extent of what we'll be releasing.
Hey, this is Paige from WBTV. I have a question about the models. Why were they released today, and how have the models changed over time since we've received more data as each day goes by?
I'm sorry, could you repeat the first part of the question?
Sure. Why were those models released today that the county tweeted out as on their website, those models with a little bit more information?
So the models themselves, we have not yet released the current projections. We will be doing that later today. What you saw was basically a frequently asked question document to better help everyone understand sort of what goes into the modeling process and some of the implications for what the models actually tell us and mean and how we're using them ourselves to better understand how we should be responding to the pandemic.
Davis with Spectrum News. I'm just wondering, with South Carolina, there have been some reports that they may be opening up some things soon. Does that mean, is there any fear for Mecklenburg County when it comes to South Carolina possibly opening things up, that we're not prepared for that yet, and that there could be a surge of people coming through the county?
One of the issues that we're going to deal with across the country is anytime you open something up in one area and you don't have the same thing happening in others, there will be impact. So we know that that's going to be the case. South Carolina, we're right on the border, and if they loosen things in those communities, we expect to see some effect on our county from that. We're just not sure what that will be at this point.
And follow-up question to that, would there be anything about enforcement near the border there?
I don't anticipate I don't know if the Deputy Chief wants to speak to that, but I don't anticipate doing any additional monitoring at the border. Did you want to speak to that?
So we don't anticipate any large-scale issues along the border. Just bear in mind, we already police criminal laws that vary from state to state there, so we're already used to the demarcation lines. The only anticipated area where they overlap a little bit would be with lakes, but we have a great relationship with our county partners across from York County there and Lancaster County. So we don't see any large measure issues in dealing with the pandemic. I know that we were ahead of them earlier, so we'll kind of be going back to the way it was prior to.
This is Brett Jensen with WBT News. This question is for Gibbie Harris. Gibbie, I know you're talking about the nursing homes and stuff like that is being released. Can you talk about, in some businesses like CMPD, and they're telling what's been in terms of positive cases, can you tell us how many positive cases? Are you keeping track of how many positive cases of employees at the local hospitals? I know it's very significant.
So we have not, but all of those organizations are keeping track of that on their own. We're not monitoring that specifically. What I can tell you, especially with our first responders, is as they get more comfortable with the appropriate use of PPE and move forward, we are seeing few first responders exposed, which is really good news. And the number of positives we have had in first responders is small compared to what it could potentially have been. The hospitals are managing what they're seeing within their walls, and so at this point, I don't have that information.
Do we know how any of these infants got the virus? Was it from their parents or from medical workers in the hospitals when they were born?
All of these children were more than a couple of months old, so the exposure was not in the hospital. I'm assuming, and it's totally an assumption, is that there was some exposure from whether it's parents or someone visiting the child at home.
Gibbie, how many infants have there been?
A total of 3, and they've all done extremely well, have recovered.
Hey, it's Tony Messia with the Charlotte Ledger. I just had a question about what's going on with the hospitals. Can you talk, and I know you said you get that data every day. Can you talk about how many people you're seeing hospitalized? How many are hospitalized now, and where that trend line is going?
That we've been watching that closely. The hospitals are running; their capacity is running about the same. That hasn't changed much over the last week. They are seeing varying numbers of people with COVID who are COVID positive in the hospitals, and a percentage of those, probably about what I'm seeing, about 30% are on vents. But that changes from day to day, and we're continuing to watch that with them. We have not seen significant upticks in that at this point.
Gibbie, you said that there were more than 19,000 tests done by hospitals. Is that the total number of tests conducted so far in Mecklenburg County, or what is that number?
That is the total number of tests that have been conducted by Atrium and Novant. We do know that there are a small number of other facilities in the community that are conducting some tests. We get the positives from those sites. We do not get the actual tests conducted. So we do know that we've got close to 20,000 tests that have been conducted in Mecklenburg County to date.
Ms. Harris, you can walk from the Mecklenburg County line to the Charlotte Motor Speedway. Do you have any opinion on whether NASCAR can have a race there late next month?
I have no idea. We're continuing to watch the data closely, and we'll see what happens as we move towards conversations around reopening different types of activities in our community and types of businesses. But at this point, it's hard to hazard a guess a month out.
You said that you're seeing a slight increase in the Hispanic community when it comes to COVID-19 cases and a decrease in the African American community. How concerning is that based on the population and the numbers that you're seeing, and why? What's causing that?
Well, one of the things that's causing it is testing is becoming more available to the Latino community. Some of the new testing sites that were opened last week are available very specifically to our African American community, but also to our Latino community. So as the number of tests conducted goes up, we expect to see positives go up. So I'm not terribly concerned about that at this point, other than making sure that all members of our community who need testing have access to it.
Given that detailed projections you guys released on your website, there was a little sentence there near the bottom that said that maybe what you guys have seen in terms of testing positive might only represent 5 to 10% of those actually infected. Do you believe that's an accurate number, that of the the amount that we have, the 1,200 that we have, that's only represent 5 to 10% that's actually infected?
Yes. So the honest answer is we don't actually know. Those are estimates from other areas who have been looking specifically to who have scaled up their testing in a more dramatic way. There was a study that came out just last week in the New England Journal of Medicine of a hospital and system in New York City that tested all women that were pregnant to sort of understand the prevalence of this virus in that population, and about 13% of those individuals were positive for COVID-19, but only less than 2% actually had symptoms. So they would not have been eligible to be tested or would have been recommended to be tested. So, just that information alone just tells us there's a lot more infection in our community. There are a lot of folks who probably have mild symptoms and they're at home, and we are not currently testing those folks, so we don't have that information available.
Hi, this is Katie Peralta with the Charlotte Agenda. I had a quick follow-up question for Ms. Harris. Gibbie, a few weeks ago, I think it was, we had asked how many of the sickest COVID-19 patients in Mecklenburg County, for instance, those who have either been hospitalized or who have died, were considered essential workers, not first responders. I'm talking about grocery store workers, folks who work in sanitation, et cetera. Do you have any further data on that? I think the county had said that they were looking into it.
I want to make sure I understand the question. Were you talking specifically about people who have died?
Hospitalized cases and people who have died, yes, the most serious.
I would, so I don't have specific data on that at this point. We're continuing to look at that, but I would hazard to say that the majority of the individuals who have been hospitalized have been over the age of 60 and have other underlying conditions. I will not say that all of them have, but the majority fit into that category.
Gibbie, it's Allison from the Charlotte Observer. I had a question about the field hospital. Is there a certain cutoff point where Mecklenburg would determine it does not need that field hospital, especially looking at the convention center to be used for the RNC?
Did you get that?
So the question was, is there a cutoff on when we would have to make a decision about whether or not we would need a field hospital, specifically as it relates to the convention center and the RNC coming up? I do think that there is a window at which it will be very difficult, if not impossible, to pull up a field hospital at the time that we need it. And so that's why we work with the hospitals very closely to make sure that they're not reaching a place where they do get that surge and they're going to need a field hospital. But we've had that conversation with them repeatedly, in that there is a lead time in order to bring up a field hospital, so that they need to track their data very, very carefully. So we're not in a position where they turn around and say we need a facility and we're not able to provide it. So yes, there is a cutoff date, and hopefully we won't ever get to that point, because they're going to be managing these cases within their four walls.
It's Hunter with WCNC. I have a quick question in regards to the small business loans. Is there an update on how many have been given out, and just how much has gone to each?
I can provide details on that later today. I will tell you that we received 241 applications and we were oversubscribed by well over $1 million. So the fund at this point is depleted. We will go back to the Board of County Commissioners and have a conversation with them if there's interest in re-upping that in some kind of way. But what I will tell you is it demonstrates the need in this community by small business to be able to access dollars to keep them afloat. And so we feel good about the fact that we were able to provide it, but clearly the need far outpaces the funds that we were able to provide at this point. So I know those applications, a lot of them are still being reviewed, so I don't have an exact number for you, but I can try to get our folks to give me an update today, and we'll push it out later this afternoon.
Ms. Diorio, last week at the meeting, you and Mr. Wade had a disagreement on whether towns have the ability to control whether Mecklenburg County can issue a stay-at-home order. Do you have any clarification or clarity on that yet?
Yeah, we're still looking at that. Tyrone has gone back and he's looking at the statutes to determine the county's authority versus the city's authority and versus the town's authority. So we're still doing a little bit of research about that, and we'll be pushing that answer out to the board sometime today or later tomorrow. Any other questions?
This is another question for Ms. Harris. As far as pushing back the curve for the June 8th date, and as the models continue to change, how much further would you?
So you completely broke up, and we did not hear your question. Can you please repeat it?
As far as the June 8th peak date and the idea that the model could continue to push back, how far out would you expect the peak to be, if not June 8th?
How far do you think the peak will go, if not June 8th, depending on the projections?
What we're seeing at this point is the curve continues to move out. And that's to be expected as long as we're continuing with our social distancing. I guess the point that I want to make about the curve is people need to be sure they understand what the curve means. We are looking at flattening the number of people who are infected at any given time. That allows our hospitals to be able to provide the care needed by the people that are infected. It does not mean that fewer people are going to be infected over time. We still have lots of individuals in our community who are at risk, who do not have immunity, antibodies to this infection, and eventually will probably be infected. So as we move forward, I just want to make sure that people understand that flattening of the curve does not mean that this goes away quicker. It means that we are positioning ourselves in this community to better be able to address the medical needs of the individuals who are infected. So what we're seeing right now is the curve continues to push out, and we will put out some more data a bit this afternoon about that.
It's Hunter. How comfortable are you with the county or the state, whichever one does? How comfortable are you with easing restrictions before we hit any peak?
That's conversation we're going to be having over the next couple of weeks about what our tolerance level is for the potential for increases in number of cases. As we start to release and make it easier for people to get around in our community, the likelihood is that we will see more cases. And that up and down may happen over time, and we've got to be prepared for that. What is going to be very uncomfortable for our community is if we relax a lot and then have to clamp down again because our numbers go way up. That'll be challenging as well. So we're going to be very judicious in our conversations. The manager, as she mentioned, is bringing a group together to have more conversation about that, and we will use all of the data and information we have available to us to help make those decisions.
It's Paige from WTV. One more question for you. Why, I understand the projections, model projections are being released after this press conference. Why aren't they being released before the media can see them? So we can ask about those specifically.
I'm sorry, I really could not understand your question. You're breaking up terribly.
Oh, can you hear me better now?
Yes.
Asking why the model projections are being released later this afternoon. Why are they being released before the media can look at them and ask questions specifically about the projections?
We have our information ready to be released now. It was not ready prior to the conference.
Okay, thank you.
You're welcome.
Okay, we have one more question, please.
What is it still June 8th?
So remember that we are modeling under many circumstances. So if you remember the last time you saw a set of curves for hospital beds, ICU beds, as well as ventilators, there's a separate graph for each one of those, and each one has 3 different curves that estimate the potential effect of varying levels of social distancing. So I will tell you that the middle of the road curve, the 45% one, is now closer to mid to late June from just about a week ago. And again, it changes every day, and so they will continue to change. And so we just hope that folks recognize that as we are not seeing a surge and a real acceleration in cases and hospitalizations, the curve will keep moving further out, which is actually good news.
Thank you, everybody. Have a great day.